Good afternoon. Today we will discuss the lab diagnosis of HIV. Before discussing it, consider three scenarios. Where the first scenario is someone who is very enthusiastic and they want to give blood donation and they give the blood donation, and after they screened the blood, it was positive for HIV. And that is one scenario. And another scenario is one of your friends who is interested in taking a blood sample got pricked with HIV positive patient. So when we will do the test, keep that in mind and we will discuss about it later. And another person who is already known HIV, and what you will do for that patient to know the prognosis of the disease. So before doing HIV test, there are many legal, ethical and psychosocial issues because HIV is very dangerous, and patients will have so much of stigma for HIV. So before doing the HIV test, we should take consent form and we should maintain confidentiality. That is, we should not disclose his positivity to others without his permission, and counsel pre-test and post-test to educate the patient about the disease. So specific tests for HIV infection is identifying directly the virus in the tissues or blood, or identifying the viral nucleic acid, or identifying the antigens of HIV or antibodies to HIV. That is, we are directly identifying either the products of HIV, that is P24 antigen, nucleic acid and virus, or indirectly we can measure the antibody against HIV. And non-specific tests, there are many non-specific tests like CD4 count, total and differential count, IgA and IgG levels, lower CD4 and CD8 ratio. These are non-specific, just keep in mind also. So previously, whenever if a person is infected with HIV, that is like through blood transfusion, a person got infused with HIV virus. So it will have a window period of around 3 to 4 weeks, and after that only he will develop antibodies to them. Previously, to identify that, we used to be like measuring the antibodies. So if we do the HIV test during this window period, the patient will be showing negative. So to identify the antigen in the window period, we have specific tests like P24 antigen, which will identify, which will give positive within 16 days of infection with virus. And another one came recently, nucleic acid test. It will show positivity within 12 days of infection during the window period. As I said earlier, I asked if one of your friends got pricked with HIV, at what time you will do the test and what test you will do. If you got pricked today, will you just test the HIV today itself? No, because at least 12 days for nucleic acid test and 16 days for P24 antigen test should be there. So at least you should wait for 12 days for nucleic acid test and 16 days for P24 according to availability. And after that, we will see. So antibody detection can be done by ELISA or a simple test, or rapid test and Western blot test. Rapid and simple tests, they require less than 30 minutes and they are non-specific. They use principles like dot blot, immunochromatography, dipstick, boom test and all. These are not important. So these are the important tests, specific tests for HIV, antigen test. So P24 is the main antigen, and it is the one which is earliest detected in HIV. This IgM antibodies are the first to appear in the blood, which will appear 4 to 6 weeks after infection, and later they are replaced by IgG antibodies, which will stay for the lifelong. So, if suppose the patient may be having needle stick injury, the process may sometimes be delayed. That is, antibody formation might be delayed, and the appearance of P24 might also be delayed. And the point to be remembered here is as P24 is positive during the window period after 16 days of infection and at the terminal stage of HIV. So, in acute infections and terminal illness only P24 will be positive. Like if with the known case of HIV patient while taking treatment, P24 may be negative. So, use of P24 is only during window period and to know whether the disease is in the terminal state or not. And the P24 antigen capture ELISA, it will have. So for ELISA, we do antigen and antibody reaction where the container we are checking these elements. The test what we are doing contains antibodies and the sample we are putting on it will have the P24 antigen and that reaction is captured. So, uses of P24 is for confirmation of diagnosis of HIV, diagnosis of HIV during window period and to diagnose the late stage of HIV and HIV in infants and monitor the progress of HIV infection. That is, if the HIV infection is more, P24 will always be more. So, remember that during acute infection of HIV and terminal illness of HIV. So, if the known case of HIV is having the high P24 means, it can be due to either he is having acute infection or he is in the end stage of HIV infection. Second is virus isolation. It is a kind of some dangerous thing to do. What in this virus isolation, from where we will isolate is it can be due to body fluids or within the cells like lymphocytes or any free cells. This virus isolation will be parallel to P24. That is same thing as I explained earlier. This virus, if the virus is isolated, it can be due to either acute infection or it is in the terminal or when the patient becomes terminally ill, viral isolation will be more. This virus, after isolating, they can be co-cultivated with the infected virus, co-cultivated with the uninfected lymphocytes in the presence of interleukin 2. But this virus isolation should not be done in every lab. It should be done in laboratory with adequate containment facility. Detection of viral nucleic acid, that is through PCR. DNA PCR and RNA PCR are done. RNA PCR is preferred in adults, whereas DNA PCR is preferred in neonates. To know whether the HIV positive mother has transmitted the HIV to the baby. Fourth is antibody testing. So, previously I said that antibodies will be developed after 2 to 8 weeks to months. Before developing this, the patient is highly infected during this window period. So, during that time, either we can do P24 assay at after 16th day and nucleic acid test after 12 days. Why we are doing this antibody test is to confirm the HIV infection. Okay, Western blot test. Western blot test means it is just a supplemental test. It will detect this HIV virus have many structural proteins like GP120, GP140, GP55, 40, 68, 53, like that and so on. This Western blot test will have all the antigens, all the protein against the glycoprotein, however, how much 54, 40, 68, 53 like that, all numbers will be there on the strip. So, if we put the serum on the Western blot, whichever is positive, it will show the positive colors. So, we can know which virus it is infected. According to WHO criteria, at least 2 envelope bands with or without gap or pole bands. That is, envelope means 120 and 160. And according to CDC criteria, any out of 2, P24, 120, 160, 41, any of the two, we can consider Western blot is positive. P24 is positive in window period, acute infection, and in AIDS. AIDS means opportunistic infections will come. So during asymptomatic infection, the patient won't have P24 positive. And virus isolation will also parallel with P24. Say virus isolation can be isolated during window period, acute infection, and AIDS, and not in asymptomatic period. So in asymptomatic period, to diagnose it, we can do ELISA or Western blot. And in acute infection, ELISA and Western blot will also be positive, and any of the tests will be positive in AIDS. So first, so after you got P24 positive, what you will do next? You will label them as HIV positive, or you will confirm it? We have to confirm it. And we should know whether it is HIV1 or HIV2 positive or both positive. So first we will do screening HIV1 or and HIV2 enzyme immunoassay or ELISA. After doing that, if we get positive, we will go for again we will repeat the test again. If the test is positive again, we will go for Western blot, and if it is positive, we will diagnose it as HIV1. And if the HIV1 Western blot is negative, we will do HIV2 enzyme ELISA again. And if the ELISA is positive, we will do Western blot again. If the Western blot is positive, we will diagnose HIV2. If during this process, what we have to remember is at least 2 tests should be positive. ELISA should be positive and Western blot should be positive, and ELISA should be confirmed twice. And if the test is negative, we should not think that it is that the patient is not having HIV. We can retest after 3 to 6 months. For suppose, if the patient is continuously getting ELISA negative, at least for 2 times, and the Western blot also negative, we can think the patient is having negative for HIV. That is serological test, and this is CDC criteria. The Center of Disease CDC and the disease escape. In CDC, they won't include Western blot. They will directly do HIV 1-2 antigen antibody combination immunoassay. If the HIV1 and HIV2 are negative, the patient is HIV negative, and HIV1 and HIV2 antibody differentiation immunoassay, if it is positive, we will do differentiation immunoassay. If HIV1 is positive, he is HIV1 positive. If it is 2 positive, he is HIV2 positive. HIV1 and 2 positive, HIV1 and 2 positive. If the HIV1 is negative or indeterminate, we will go for nucleic acid test. If it is positive, acute HIV infection. If it is negative for HIV. First in HIV suspicion patients, we will go for HIV 1-2 antigen antibody immunoassay. As explained earlier, if it is negative, we don't have to go for unless we have strong suspicion, no need to do other further tests, and we can repeat after 3 months if we need. If the immunoassay is indeterminate or positive, then it should be repeated and a NAT should be done again. And if the NAT is positive, it is acute infection. So this is just a flow chart. HIV, we will do the HIV test, and after that we will go for HIV RNA testing with the NAT. And if the NAT is positive with negative antibody, that is antibodies are still not formed, that is the patient is in window period, and NAT is positive, that is suggestive of acute infection. And if the NAT test is negative, HIV2 should be tested. And if the HIV2 is positive, we can do ELISA and followed by Western blot. If NAT is negative and HIV RNA, HIV antibody is also negative, we can label the person as HIV negative. Some kits are also available for home use. Example, Aura Quick. Or we can also give sample. We can also take the sample in the home and we can mail it to a lab. There are several tests which can be done like that. And this simple test, if they come positive, we should not label them as HIV positive, and we should confirm it with the specific test as I said earlier. like P24, HIV RNA, RNA PCR, and virus isolation. So, HIV RNA measurement in plasma of patients with HIV infection is used for understanding the HIV pathogenesis and monitoring the response to ART and providing diagnostic tool in settings where measurement of anti-HIV antibodies may be misleading, such as in HIV acute infection and neonatal infection. So, for suppose the HIV RNA keeps on increasing, the ART we are giving, highly active antiretroviral therapy we are giving, might be resistant to this HIV virus might be resistant to that, or the patient might not be competent. So we use this HIV RNA to monitor the response to ART. So lab monitoring of patients with HIV infections. CD4 T cell count, HIV RNA determines HIV resistance testing and other tests like beta-2 microglobulin, IL-2 receptor, IgA, etc. CD4 T cell count. In the previous class also I told that opportunistic infections are common if the CD4 count falls to less than 250. So if we start the patient on antiretroviral therapy, CD4 count will keep on increasing if the patient is adhering the treatment. So why we will monitor CD4 count is if the patient is having CD4 count of less than 200, we have to start the prophylaxis for Plasmodium virulency, and the patient is very high risk of developing plasmocystis pneumonia, plasmodium virulency pneumonia, pneumocystis virulency pneumonia, and when the CD4 counts fall to less than 50, the patient is prone to infections like CMV, mycobacteria, atypical mycobacteria like Mycobacterium complex and Toxoplasma gondii. So, if the CD4 count is less than 50, we have to keep prophylaxis for Mycobacterium complex and Toxoplasma gondii. And if the CD4 count is usually after diagnosing HIV, we'll check the CD4 count during that time and every 3 months later. And later again we can change it to 6 months. So if the CD4 count is very less, we have to do frequently like monthly once. And if the CD4 count is more than 500, patients can be monitored yearly once. HIV RNA determinants. HIV RNA measurement is mainly dependent on activation of immune system and it fluctuates with the secondary infections and immunization. So we should not solely base our diagnosis based on HIV RNA levels, and this HIV RNA levels like CD4 count, they also help in assessing the prognosis of the patient. They should be monitored at the time of diagnosis and every 4 weeks until the effectiveness of ART starts. HIV resistance testing, it can be done through genotypic assays or phenotypic assays. Genotypic assays, sequence analysis of HIV genomes are obtained from the patient and compared with the sequence of viruses with known antiretroviral resistant profiles. And in phenotypic, we will grow the patients beside the viral isolates or genetically constructed pseudoviruses, and is compared with the growth of reference strain of viruses in the presence and in the absence of antiretroviral drugs. So, positive ELISA with the positive RNA can be considered as gold standard for diagnosis of HIV. And I asked 3 questions. One I told, if one of your friends got pricked, and when you will do the testing. 12 days by NAT or 16 days with the P24. And another one, randomly someone donated blood and screened and got HIV positive. What test you will do for confirmation? You can do either HIV RNA and virus isolation, or another one, Western blot also we can do. So, but at least in that ELISA should be done twice and it should be confirmed by Western blot. So that is one scenario. And the third scenario is the patient is already having HIV, to know the prognosis, or we'll check. That is whether the patient is improving with therapy or it is progressing. CD4 count. CD4 count should be more and HIV RNA load should be very less.